Now we'll be talking about the quinolones group of antibiotic or fluoroquinolone group of antibiotic. Now, these are highly active against gram-negative bacteria, and some of them they also do have activity against gram-positive bacteria. So when it comes to gram-negative bacteria, they actually inhibit the DNA gyrase enzyme, and when it comes to gram-positive bacteria, they inhibit this topoisomerase 4. So, of this, the ciprofloxacin is one of the most important drug in this class. This is the most potent first generation fluoroquinolone group drug, and it is a very good drug, which is excellent medicine against especially aerobic gram-negative bacilli. Now, it kills so many gram-negative bacteria, especially like E. coli, Klebsiella pneumoniae, Salmonella typhi, Shigella proteus. Most of them they cause gut infection, acute gastroenteritis, colitis, UTI, pyelonephritis. These all problems are usually caused by these bacteria. And this Neisseria gonorrhea, Neisseria meningitis, these very commonly cause meningitis. This Haemophilus influenzae, Campylobacter jejuni, and Vibrio cholerae. These also bacteria are excellently killed by the ciprofloxacin. Vibrio cholerae causes cholera, and it is one of the very easily treatable disease by the ciprofloxacin. Now, the other bacteria which are very important is Pseudomonas. We must know Pseudomonas is very, very bad gram-negative bacteria, and it is elicited in gut infections, UTI, chest infections, pneumonias, all the infections, soft tissue infections, osteomyelitis. It is caused by Pseudomonas. This is very effectively killed by this ciprofloxacin. In gram-positive Staphylococcus aureus, Legionella, some Brucella and Listeria, these bacteria are also very effectively killed by ciprofloxacin. Now we must know that these are bactericidal. So in short, they will kill the bacteria completely. They have high potency and they have excellent long post antibiotic effect. What is meant by long post antibiotic effect? It means that as soon as the antibiotic is given, even if the antibiotic is cleared from the blood, still these bacteria which are susceptible to the drug, they still their growth remains inhibited for long and long period. So even if the drug disappears, suppose at 4 p.m., the still till 8 p.m., 9 p.m., or maybe till next day, the bacteria will not start to regrow. This is called post antibiotic effect. This effect is only seen highly with two drugs. One is fluoroquinolones like ciprofloxacin, levofloxacin, and other is aminoglycoside like kanamycin, streptomycin, and other aminoglycosides. Now, one of the important aspect of the ciprofloxacin is it has a very low frequency of mutational resistance. So chances of developing resistance against the ciprofloxacin remains compared to lesser compared to other fluoroquinolones. It is highly active against many beta-lactams and aminoglycoside-resistant bacteria as well. So it can be effectively combined with beta-lactams, or it can be given with in those patients where aminoglycosides are not helping out. You can switch over from aminoglycoside to ciprofloxacin. Regarding pharmacokinetic, we must know that food delays the absorption of this drug, and it has excellent tissue penetration. It has excellent tissue penetration means it penetrates very well into lungs, sputum, muscles, prostate, and apart from that, it has excellent availability in the urinary tract and biliary tract. That is the reason why it can be used for the pneumonias, LRTI, bronchitis, COPD. It can be used for the road traffic accident, wounds. It can be used for prostatitis. It can be used for UTI, pyelonephritis. It can be used for cholecystitis. The adverse effect of these drugs are nausea, vomiting, bad taste, insomnia, irritability, restlessness. But these are quite manageable or they are not that much common. Whereas tendinitis and tendon rupture is a very problematic issue. That is the reason why we usually avoid giving ciprofloxacin in elderly patients above 60 to 65 years of age, and we avoid that in children of less than 8 years of age. It is absolutely contraindicated in pregnancy, so there is no reason why we should use this in pregnancy. Uh, it very commonly increases the concentration of warfarin, caffeine, and theophylline. So, if you are giving warfarin with ciprofloxacin, we need to be better, very careful with the INR, and it can potentiate the effect of caffeine and theophylline as well. We must know this is one of the very good wide spectrum antibiotic. It kills gram negative mainly, as well as some gram positive bacteria as well. They are cidal. They have very good oral efficiency, efficacy, and tolerability. They are excellent in UTI, prostatitis. They are one of the first line drugs which are used for acute gastroenteritis, especially whenever it is bacterial or whenever there is dysentery. This is one of the first line drug for typhoid fever also, and they are excellent choice when it comes to bone infections, soft tissue infections, gynecological infections like cervicitis, vaginitis, because the soft tissue penetration, skin penetration, bone penetration, wound penetration of this fluoroquinolone group of antibiotic is excellent. So they are used in osteomyelitis, joint infection, and they are one of the very good choice even in diabetic food. As we know that the lung, sputum, they have excellent penetration into these tissue. We very commonly use it for mycoplasma infections, Legionella infections, pneumonia infections, and chronic bronchitis, LRTI, pneumonias, we can definitely use. It is one of the most important second line drug for tuberculosis, and it is specially used for MDR. Whenever we are saying that it is second line drug, usually it is a multi-drug resistant tuberculosis. A gram-negative sepsis, ciprofloxacin can be one of the excellent drug of choice, which can be used with the third generation cephalosporins to cut down the sepsis and to curtail the infection severity. Even though the CSF penetration of the ciprofloxacin is not very good, it can still be used in meningitis and it can help a lot in meningitis. So this was all about ciprofloxacin. The dosage, it comes into 500 milligram. It comes into injection form as well as tablet form. Tablet form very commonly 500 milligram twice a day is very commonly used for 5 to 10 days depending on the severity of infection, depending on when the fever subsides. In injectable form also, injection ciprofloxacin 500 milligram twice, 2-3 times a day can be very commonly used for chest infections, respiratory tract infections, urinary tract infections, cholecystitis, soft tissue infections, pyelonephritis, bone infections, and this is one of the excellent choice when it comes to bactericidal activity. Thank you.